and Services and Aging Committee meeting Wednesday, September 20th, to order 1 o'clock. Madam Clerk, if you could call the roll, please.
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll for Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Stevens. Ms. Stevens is absent. Ms. Turner.
Present.
Mr. Miller.
Present.
You have a quorum.
Right. And I'd like to just make a motion for Councilwoman Stevens for her absence, even though it's not required. Can I have a second?
Second.
Moved by Conwell, seconded by Turner. All in favor, please say aye.
Aye.
All right. Anyone signed in for public comment?
No, Madam Chair, no one has signed in.
All right. We will, I know I still have approval of the minutes, but we will go out of order today. We will have CASA do their 10-minute presentation prior to getting into the contracts. Can I have a motion for the approval of the minutes from the July 26th?
Second.
It's been moved by Turner, seconded by Miller. All in favor, please say aye.
Aye.
All right. Madam Clerk, can we invite Jim McCafferty up to the podium, please? Thank you.
Good afternoon, council folks. Councilman Miller, Councilman Sweeney, Councilwoman Turner, and Chair Yvonne Conwell. Here to talk to you
Excuse me,
about.
Mr.
You gotta
McCaffrey, if
state
you could
your
just state your
name.
name for
Oh,
the record,
And
please.
your guest name.
See, back under the commissioners, we didn't have to do all that.
Right.
We just talked.
It's a new day.
I'm Jim McCafferty. I'm with the Court Appointed Special Advocates Program. I am the board chair of the program. I have with me today Dennis Kusler, who is actually a court-appointed special advocate for children in Cuyahoga County. And we're here to talk to you about our program today and our needs. CASA is a national program that actually started in 1976 in Seattle, Washington, by Judge Sukup of the Seattle King County Juvenile Court. The program took its first children in 1977. What's interesting is that was the year in Cuyahoga County that the Guardian Ad Litem program started. And if you're aware, the Guardian Ad Litem program is a Rule 15 program through juvenile court that appoints an attorney to every child who comes into the custody of the Department of Children and Family Services. What's different with a court-appointed special advocate is there are individuals with experience who are trained to work with these children, but they don't necessarily need to be an attorney. In fact, while many of our CASAs are attorneys, many are not attorneys. There are over 1,000 CASA programs in the United States and roughly 50 within the state of Ohio. It's actually 40 CASA programs serving 50 counties. A number of the smaller counties jointly have a CASA program serving them. CASA started in Cuyahoga County in 2015 with a steering committee that was created to plan and implement a CASA program in this county. We began taking children in 2017, so the CASA program's roughly 6 years old in Cuyahoga County. In most parts of the country, you have a Guardian Ad Litem program that can either be an attorney or it can be a court-appointed special advocate who's not an attorney. Cuyahoga County, as I stated, we have Juvenile Court Rule 15, which requires an attorney to be appointed to every child's case. And we're not here to dispute that. We like the Guardian Ad Litem program. But I'm going to give you an example. When I was Director of Children's Services in the early 2000s, we had over 300 Guardian Ad Litems in this county. Today, there are 70. We have about 80 CASAs today. So if you put the CASA program and the Guardian Ad Litem program together, we have roughly half the coverage we did back around 2003, 2004 for the kids in this county. So we're not asking to change that. We're just asking to be able to grow our program, the CASA program. And at this point, I'd like to ask Dennis to come forward and talk to you a little bit about what a CASA actually does daily with kids and his experience being a CASA. Dennis?
Thank you, Jim. Good afternoon. As Jim said, my name is Dennis Kusler. I am actually a CASA. This is what one looks like. And I've been a CASA since 2017. And I'm actually really passionate about the program. I got involved in it after I retired As part of my volunteer work, I started to do some things with the Boys and Girls Club and doing some work with the Cleveland school system, and really got to really love these kids and just wanted to find more ways to work with them. So as a CASA, it's one of the few things that I've probably ever done in my life where I look back at the end of the day and said, you know, today I actually made a difference in a kid's life. And so the way we work is, as Jim said, we work in conjunction with the guardian ad litems. We work in conjunction with the folks from Child and Family Services, and we get invited by the judge, by the magistrate, to get involved in the course. What we bring to the table, and there are always cases of abuse and neglect, or a couple of times they may just be custody cases, but we bring probably three things to the table. The first one is when I go in to sit down with a family, we're able to completely change the dialogue, because I come in and basically say, I'm not an attorney, I'm not with DCFS. I'm the only one here who is here because I want to be here. I am a volunteer. I'm here because I care. And with that framework, I'm able to just build a kind of a different kind of relationship with the families, and it's even with the kids, than some of the, because they know I can't take their kids away. I can't make any decisions like that. I'm not a lawyer, so I'm not going to make any motions or anything. What I want to do is try to understand the situation, try to understand what you need, what can we do to fix this. Now, sometimes we can't, but we're going to try to do that. The second thing we bring to the table is the time. As Jim said, a typical, my experiences with the folks from DCFS, they do an amazing job, but they may be carrying 25 to 30 cases at a time. Same with the guardian ad litem. They're typically running their own practice, and they may have 7, 8, 10 cases that they're also advocating for. In my case, I do one case at a time. That's it. Sometimes it might be two if we're winding down. So I have the ability to visit the family several times a week. I have the ability to do the research, to go to school and spend a day at school, to get involved in their educational plan, to view them in that environment. I have time to sit down with their doctors and see, you know, how they're doing, and also to help the family out with there may be different things. I mean, I just was working with the family, helping them find some services. Not that other county resources couldn't do it, but because I'm there so often and have that dialogue with them and can have the 2-hour meetings, just sit down and talk and listen with them. So I think because of that, we were able to change the dialogue. So when we make a recommendation to the judge, we're giving them a different perspective than the other. And based, you know, I can really say, based on my experience, based on my interactions with these folks, this is kind of where we're at. The other thing that I wanted to make sure that I mention is that even though I'm a volunteer and even though my background isn't this, we probably get as much or more training than the other folks do. I mean, we go through an extensive training when we start. It's upward of 30 hours in addition to all the checks we do. And every year I have to do my 12 hours of training, which I'm still 3 hours short this year, as I was just reminded the other day. But, you know, we constantly keep current. And also, each one of us has a volunteer supervisor who's always available for us. And again, because we don't carry some of the workload, I have, in my case, her name is Samantha. I have complete access to Samantha. So typically, every time I make a call, at least twice a week, I'll be on the phone with Samantha. Hey, I heard this, I see this. Do you have any ideas? And, you know, she'll help me either pointing out resources, giving me some ideas. So with that, I feel like I'm part of two teams. I'm the team working with the ad litems and the DCF folks. I've also got the team of the CASA folks, and we also meet regularly, pretty much over Zoom now, with the other CASAs, where again, we trade our cases, we talk about ideas, you know, hey, I've got this situation, how do you handle it? So again, I think in a net, what I can say is I think what we do is complement the whole situation by bringing a different perspective. Thank you very much.
Thank you.
Council, in 2017 to 2019, the Guardian Ad Litem program in this county and the CASA program were housed in the same nonprofit, Child and Family Advocates of Cuyahoga County. In 2019, the juvenile court took the CASA, or the Guardian Ad Litem program, in-house as a budget-cutting activity to save money. So we split the two programs out. When we had the Guardian Ad Litem program, We received a county contract of $109,000 a year, which in terms of the county budget really isn't that much money. And what we're here today to ask is that you consider reinstating that contract for a CASA program. And I'll tell you what you'll get for it. Right now, we have lost 2/3 of our VOCA funding. We get victims of crime money from the federal government. 2017, we got $600,000 a year, a little bit more than that. Today, we get $200,000 a year. So we've lost 2/3 of that funding, which is a huge hit to our budget. We've gone down to 2 volunteer coordinators. We have these CASAs like Dennis, who are wonderful people, but they need supervision. They need to be trained. They need ongoing training. They need background checks, all the things that a worker at DCFS would need, for example. So those things cost money. When we first started the CASA program, an administrator from the juvenile court came over and told council at that time CASA was a free program. That wasn't correct. CASA volunteers don't get paid for their time. However, they have to be recruited, they have to be trained, they have to be supervised, and that costs money. If we can get this contract, every penny of it will go to hire 2 additional volunteer coordinators, which will allow us to double the number of CASAs that we have working in Cuyahoga County, which will double the number of children that we're serving. We presently serve probably 150 children a year. We're going to be able to go up to over 300 children a year. We recently got an agreement with the juvenile court that we're invited to all the EC hearings that occur at the court. That's a great thing, but our problem is CASAs can only carry 1 or 2 cases at a time. They can't carry caseloads like a social worker at Children's Services does. If we don't have more bodies, we can't take more children. Councilwoman Conwell has been so gracious to us. She's working on trying to get us some office space through the county to help with that. But that won't meet our immediate need, which is to hire additional paid staff so that we can bring on additional volunteers, supervise and train them, and serve more kids in Cuyahoga County. So I'm asking that, as well as looking at office space, that you do seriously consider the small contract of $109,000 with our program so that we can serve kids in Cuyahoga County. I would also say we would want to target recruitment of CASAs to the inner city, to the city of Cleveland, and especially African-American males. We have a dearth of individuals of that, black males that want to serve these kids. We want to grow that population of CASA because 66% of the children we serve at this point in time are minority children. With that, be glad to answer any questions. Thank you for your time and for putting us on the agenda today.
Oh, you're welcome. Just wanted to dwell down into the 109,000. You mentioned that, to my understanding, that it used to be in the budget, but it was it a shared 109,000 between Guardian ad litem and CASA?
It was a contract to the Guardian ad litem project for $109,000, and it came to us when the Guardian ad litem project came in. Technically, it was for guardians, to pay for services for guardians, but a lot of our administrative staff, training staff, whatever, did double duty, so it certainly helped us. But again, the court, in a cost-saving measure, took the program internal to the court, and I don't really know what their costs are today for that.
We'll have to check into that. I'm going to open up any questions from my colleagues. Councilman Miller?
If you had unlimited money and could serve every child in Cuyahoga County, how many would you typically have per year?
How many CASAs would we need?
Yes.
Well, if the numbers I saw recently are correct, roughly 2,500. I'll round the number up, make it easy. 2,500. If every CASA can have 2 cases, 2 families, I would say that'd be about 1,250 CASAs if my math is correct. We'd have 1,250 CASAs in this county, and I believe we could recruit that number.
So since you currently have less than 1/10 that number, how do you choose which children get served?
really by cases being referred by the court. When the project began, we had an agreement with the court that we would take protective supervision cases and some other cases referred by the court. We still take protective supervision. Judge O'Malley at the court asked us to consider taking some private custody cases from the court, so we're taking those. And we take EC cases that we're invited to when we have an opening. Dale, it kind of comes down to if we have a spot open, we take the case.
And you said that Rule 15 requires that all of the children have attorneys.
Yes, an attorney guardian ad litem. Every child in custody of the Children Family Service, Department of Children and Family Services has a guardian ad litem appointed, and it's Cuyahoga County Local Rule 15.
So, since you said there's less than 100 guardian ad litems, they must have large caseloads.
My understanding is yes, they do. They did back in the day too. I mean, that's not different. When we had 300 guardians in the mid-2000s, we had 6,400 kids in custody. So they had large caseloads back then as well. But as Dennis said, most of the guardians are great men and women. They're very good attorneys, but they're in private practice. So if they have a workers' comp hearing and a juvenile court hearing, they're going to go to the hearing that pays their bills because they have a secretary, they have office staff, they have to maintain an office, a home. So they do have very large caseloads.
Do the guardian ad litems get any compensation, or is their service also volunteer?
No, they get paid through a county, through your Cuyahoga County.
Okay, thank you.
Any other questions? Councilwoman?
What metrics exist to determine if you're making a difference?
We had a study done by Case Western Reserve University and Cleveland State University combined that made a determination that having a CASA assigned to a child's case shortens their length of stay in custody. And we're getting money from the Cleveland Foundation, we hope, to have them come back out and do a follow-up study to see if this holds true 3 years later. But we do have a study, and I'll be glad to share that with you, Councilwoman Turner.
Thank you.
All right, anything else you'd like to share? We appreciate.
Now, we've been here, we thank, again, Councilman Kamala, I know you're working on the office space. We appreciate that. Our biggest need is cash. Unfortunately, we can't take more children without the supervision of the CASAs. That's critically important. So we thank you for hearing us, and we're here whenever you need us.
Final thought is, I know you said you were roughly cut 2/3, and I don't even know if we're close or could give anything, the 109. How do you plan on making up the other difference that you were?
Well, you know, we go to all the foundations in Cuyahoga County. We actually go to all the foundations anywhere in the state of Ohio, nationally. One of the things the money from the county will do is when we talk to foundations, a lot of times they say, ask us, well, how much money does your local home county give you? And when we say, well, they don't really give us any money, they kind of give us a side look and say, well, that's interesting. I believe if we had funding from you, we'd be able to use those dollars to bring in additional foundation dollars across the country to support the work we're doing. That we'll be able to use that as a match, so to speak. We do get some money from Ohio CASA, not a great deal of money, but some money. But I think besides just paying for our 2 new staff people, just being able to say Cuyahoga County funds us to the tune of $100,000, we're going to be able to use that to get some foundations to match that and give us additional dollars.
Thank you. Thank you, Dennis.
Thank you.
Very enlightening, very enlightening. All right, Madam Clerk, if you could read the first item into the record.
Resolution 2023-0222, awarding a total sum not to exceed $250,000 to Mobile Med One, doing business as MedWorks, for the purpose of expanding MedWorks oral health and dental care in Cleveland from the District 7 ARPA Community Grant Fund.
Thank you. So the two ARPA applications that will be today. Whoever's presenting for MedWorks, please come up, state your name for the record, and who all else that is with you. Because we live stream, we need to have names.
Hello, thank you for inviting us. I'm Charnel Robertson with MedWorks, the Executive Director.
Zach Ponsky, founder and board chair of MedWorks.
Rosemary Pierce, Director of Advancement.
Shannon Mathers. I am a 10-year volunteer as well as the supply coordinator.
What's your name again?
Shannon Mathers.
And what we want to present to you is, we'll start out with a video, kind of give you an overview of what MedWorks is about.
MedWorks began as a concept on how to deliver health care to the city of Cleveland that could try to combine the wonderful resources of Cleveland in medicine, which are the best in the world, and then to bring them together to deliver care for free with no questions asked to all segments of the community, to the people who are least able to get access it.
I would describe it as an organization that makes people's lives better. You have people that come into the clinics that come in scared, not knowing what to expect, and I will tell you, they always walk out with a smile with the care they've received.
We have a disconnected medical system, and what MedWorks does is it provides access by organizing it for people.
Part of what we do is imagine the future and try to meet needs both today and for tomorrow, delivering medical care, and then dental care, and then women's health, vision, mental health care, and the navigation services to have the best medical care for their families. So we're reaching out to more diverse communities throughout the city, immigrants, LGBTQ community, the justice system. They know they can come to us without any questions, and we'll provide that care then and with a plan for the future.
Edwins is a 6-month culinary program where we work with men and women who've been formerly incarcerated. Medicine is a huge barrier, so a lot of times when our men and women are coming home, they don't have an active gauge of where they are at health-wise. There's also, unfortunately, a stigma with regards to healthcare. They don't have a trust for the healthcare system, so that's why MedWorks is really important. They're able to come in pretty early on. They're able to connect our students with primary care physicians, with specialty care. They work on the food stamp application, Medicaid, making sure that their Medicaid applications are relevant.
It's done in a way that this is very genuine, this is very caring, this is very helping people at kind of a person-to-person level.
It was absolutely amazing. Like, the wait was not long. It seemed like they wanted to help us.
I think a lot of things that happen when you're looking to get dental work or medical care, you have to talk to a lot of people, fill out a lot of paperwork, and this was kind of smooth and easy, so it made it a lot simpler for us, especially since there's 4 of us. So,
you know, I don't have insurance, and I got taken care of by some people who volunteered their time, and they took care of me. So I'm just so happy about that.
I had got a flu shot and got to talk to a social worker who was very, very, very helpful today.
Having a clinic like this for helping people like me, I thank God for this.
Thank you. Thank you. So we will go into a quick PowerPoint to kind of lay out some of the things that we would love to do for the community with the expenditure that we are asking for. This will be oral health and dental care expansion. Just first want to talk quickly about us. Our mission is to provide a collaborative portal for every patient that needs quality health care and to establish that access to the permanent medical home in Northeast Ohio. Our vision is to ensure that patients throughout our community will receive ongoing health care, ongoing quality medical health care needed to lead their healthy lives. And MedWorks does an array of things. You know, we take pride in being able to to bring accessible quality health care in connection to insurance, education, medical homes, wraparound services to those greatest in need. We also provide transformative care with restored smiles, vision, including detection of cancer, chronic diseases, access to mental health, and connection to that follow-up care that's what's most needed to our patient population. We also have we are unique in a way that we provide a safety net to the safety net. We're addressing the gap in the complicated healthcare system, including that trust barrier, which is the number 1 concern for the patient population, patient populations we serve. And then we're also focused on the health and wellness as a gateway to helping people lead to an independent life and well-being. And I'm sorry, I'll pause there for a second and allow Zach Ponsky to talk a little bit about our
Thank you, Charnel. So thank you for your time, everybody on council. I just want to give a little background of our program as it relates to dental. As you saw in the video, this is a very simple organization. We started this organization with the basic premise that people in our community have a lot of needs, and we have a lot of people in the community that have trained skill sets that are willing to give their time to help those people in need. So it doesn't take a scientist to figure out if you got people that need help and people willing to help those people, let's put them together. And that's what we did. And this organization has thousands of volunteers that have been with us from the beginning, Shannon being one of them, leading our dental. But we really just try to find the gaps and fill the needs, and that's what we do. So when we look back at our dental program, we were modeled after an organization that we learned about actually on 60 Minutes, a guy named Stan Brock, who started an organization in Appalachia called Remote Area Medical. And we got in touch with him. I drove down there to see what he was doing in Appalachia. And we said, well, if he can do that in Appalachia, imagine what we can do here in this region where we have so many trained professionals and resources. What they had done, which we have never been able to do, was stand up a massive mobile dental operation. That organization, as well as others around the country that have followed that model, had dental equipment setups that we have always wanted to have here, but have been limited to be able to do. So when they go out in Appalachia or wherever they're doing them, they would take a gymnasium, they would set up, like you saw in the video, a whole array of dental chairs and equipment and suction and sterilizers, and they could see massive amounts of people and provide cleanings, extractions, prosthetic dentistry, fillings for cavities, all these things that could be done on a large scale. So when we came to set up in this area, we had this, we didn't have that equipment. All we had were the dentists and the dental professionals willing to help the people, but we were limited by equipment. So what have we done for the past 15 years? We would go out to smaller dental practices, the FQHCs, which may have 2 or 3 dental chairs, and we would bring patients in on a Saturday with our volunteers, and we'd see them in those restrictive environments. A couple years ago, we finally were able to figure out that we could rent equipment from a dental organization out of state and pay a huge amount of cost to bring them in, and every year now, which Shannon helps lead, we run a dental clinic at the Huntington Convention Center for 2 days, 120 to 150 dental chairs that we bring in with the suction and the sterilizers and the lights and all the hand pieces, and we will see 1,000 people over those 2-day period, all for free, no questions asked, and then get them all connected to a medical home, which we are not. We want to get them connected into the healthcare system that is disconnected. It's amazing. I invite all of you to come. It's coming up in November at the Convention Center. But it's not perfect. The reason it's not perfect is we're limited because of the massive expense to truck all this stuff in. We're limited to do it once a year. So the big idea is, well, what if we could stand up a dental clinic, a mobile operation like this throughout the year? We have the people willing to see the patients. We have the patients that need help. What if we could take equipment and get funding to stand up 25 or so dental chairs and go into a gymnasium at Glenville High School, and go into a church, and go into the juvenile detention center, which we're now working with to provide dental care for the kids in need. So this grant allows us to take what has been a restriction of our ability to see people and allow us to take equipment on our own without relying on it, bringing it in once a year, and taking it throughout the community where it is needed, when it is needed, and mobilize our volunteers around that equipment. Thank you for your consideration of this funding.
Thank you, Zach. That actually brings us into our next slide where we're talking about our purpose and intent. Dental care, if you didn't know, is the #1 unmet health need in Northeast Ohio. And the Cleveland Clinic recently did a community health needs assessment on their main campus area, and it identified that there is a dental professional shortage in the region. And that lack of dental care is a barrier to the overall health of our community members. The purpose of the fund is to request and to address the oral dental health equity gap that exists to those who are uninsured and uninsured, underinsured for various reasons, which lack of access to proper quality health care in Cuyahoga County. And our intent is to provide patients of all ages, families, individuals, access to complete, episodic, and preventative dental care and education. And as you see on the slide, CDC's states among working age U.S. adults, over 40% of low-income and non-Hispanic Black adults have untreated tooth decay. Untreated oral disease has a large impact in the quality of life and productivity. I do want to bring Ms. Rosemary Pierce up to kind of dig deep into the impact and objectives that we want to present.
So our objectives are to provide episodic and preventative quality oral health and dental care to 1,500 plus residents annually, positively impacting overall health and reducing incidence of disease. So oral infections are connected to diabetes, hypertension, incidence of stroke. It's even connected with low birth weight and prematurity. A recent study showed that oral health is more highly correlated with prematurity and low birth weight than consuming alcohol throughout an entire pregnancy. And we know that this is a problem in Cuyahoga County, that this is one of the worst places for women of color to live. 56% of our clinic patients currently are Black or of color, non-Hispanic, and 75% of our patients live in Cleveland and the first-ring suburbs. So we are currently serving those people. This grant will help us to scale over a 3-year period up to treat 66% more of Cuyahoga County residents. We want to shift regular oral hygiene patterns through education and access and assistance with health insurance enrollment in connection with dental care homes. Each of our patients meet with a healthcare navigator who can provide a connection with a primary medical home, enroll patients with health insurance or the healthcare access plan, connect them with HEAP, SNAP benefits, childcare, and creates a patient profile in our CRM for every single patient. Any patient that has immediate needs is flagged in our CRM. Our navigators follow up with them and follow them to make sure that they are getting the connection and care that they need. We want to reduce barriers of access, including trust, with a regularly scheduled mobile dental clinic located in neighborhoods where need is greatest. We know that public health is we know that race is a barrier to care in Cuyahoga County right now, and that trust is a public health crisis. Our surveys show that 93% of our patients are extremely satisfied with the care that they receive. So we are successful in connecting people with their primary medical homes and bringing them into the healthcare system and building trust. We will start our quarterly dental clinics in Q2 of 2024 if we are awarded this grant. We will engage volunteer professionals who are volunteers. Paraprofessionals will receive continuing education credits and be mentored by seasoned professionals in the field. In that way, we are targeting the dental professional shortage. We will provide multiple services at each clinic. So this grant will not only allow us to bring dental clinics quarterly, with that will come vision care, possibly HIV screening, vaccines, other types of primary and medical care needs, depending on the specialists that are available. But we will certainly pair vision with dental. Services will be available to all, no questions asked. So we serve all ages, we serve anybody. We do ask every single person to fill out a registration form. We do ask their name, we ask where they live, we ask for demographic information, but they are not required to fill it out. So if someone says, I'm not comfortable filling this out, or they say, I'm Mickey Mouse, we still treat them. So they can have complete anonymity if that's what they feel like they need. Community engagement will occur throughout our hosts and resource partners and mission ambassadors. So we engage several partners throughout the region to deliver this care. We collaborate with local FQHCs and the major hospital systems to host our clinics. We engage other community service organizations to advertise our clinics, promote them to the people who need them most, and we engage resource partners at each of our clinics to bring different resources that address all social determinants of health to each of our clinics. So when you attend our clinic, you're not only getting the service that you need for yourself, you can get a service for each and every member of your family. Our clinics provide, on average, 2.5 services to each individual that attends the clinic. So they're not just getting an extraction. They might get a cleaning, they might see a dermatologist, and get free eyeglasses. And studies show that people are more likely to access care if they can access multiple services in a day for more than one member of their household. Thank you.
Thank you, Rosemary. Our potential sites and timing, as you can see on the presentation, we already have a few already scheduled. As you see here, UH Otis Moss, this will be our second annual clinic there. This previous year, well, beginning of the year, we provided 70 patients with over 300 services that day, and that included oral screenings. We have implemented oral screenings in all of our medical clinics. Homeless Stand Down, April 2024. That would be very huge for us. And then our annual two-day clinic, which is the Huntington Convention Center, already on our schedule for November of 2024. Our goal also is to provide and bring these dental chairs to our women's health clinic. We're still determining that location and the amount of patients we can see. We also have we're gearing and planning and wanted to kind of get involved in the back to school events by providing general oral health screenings as well as education, and then those sealants for children, which is most needed in our community. We want to thank you all for your time and consideration, listening to our presentation. And there's a quote here from a patient here that states, MedWorks doctors repaired my teeth, and within weeks I had a job. MedWorks gave me back my smile and employment. So this is the type of work that we're putting out in the community, helping people get back to an independent life. And we thank you.
Thank you. Any questions from my colleagues? Councilman Sweeney. Now, come on now. And then Miller.
Madam Chairwoman,
Slow it up.
Madam Executive Director, your wonderful team, just wow, right? it's incredible what you do. Just the 250, is that enough to get you all the equipment you need, or is that just a start? Because when you said you got a whole bunch, 150 things, I don't think 250.
That would give us a great start to be able to purchase 25 chairs. That expenditure would basically allow us to provide lasting effects into the community and overall health of our community members.
Got it, and through the chair, the maintenance of the chairs.
Maintenance of the chairs,
that stuff.
autoclaves to obviously clean out, sterilize the equipment, the dental units that would have to come with them and travel with them. Basically, everything you see in a dental chair would be on a mobile unit. And we would carry those with the dental chairs at all of our clinics, including the autoclaves.
Yeah, through the, this is not me, Marty, micromanaging, just trying to
No, it's okay.
conceptualize all the different components of the 250, but then the other ones are delivered. Do you have the trucks to deliver? Do you know, do you need the manpower or woman power to set it up? Because that's
Yes,
exercise.
and that's we're volunteer based. So keep in mind that we have volunteers that have been with MedWorks since the existence.
10 years, we got a 10-year back there.
Yes, and
Did she get a pin?
Yes.
And then you had me until I saw Ed Eckert on the video. Delete him, and you're going to get a lot more support.
No. He's a great partner. We can't delete him.
He's my buddy from 20 years at City Hall, so you have to tell him I said that.
Okay, we will.
Appreciate that. But it's just, I mean, I'm more than happy to support it, but the credit all goes to the District 7.
Absolutely. Yes, and we do appreciate it. Yes.
Thank you.
Thank you very much. And can you tell me, is MedWork a national organization, or is it a couple localities, or is it just Cleveland? How is it organized?
So we cover Northeast Ohio. We've been in Lake County. We do have our navigation team, which is the staff that connects our patients to primary medical homes. They're in 5 counties, including Cuyahoga. So they serve Lorain, Huron, Stark, and Summit, as well as Cuyahoga County.
And how is the operations of MedWorks funded?
We're funded in many different aspects. We have corporate funding as well as foundation funding. We do have an annual fundraiser that also helps to cover some of the costs. And I'll let our development of advancement, who's much more experienced on giving this detailed information.
Well, I don't have much to add.
Excuse me,
to
can you
that.
speak into the microphone, please? Thank you.
Sorry, I don't have too much to add to that. But I will say that we have been able to increase funding from some of our regular reoccurring funders in the past year up to 75%. Our Delta Dental, which is a national organization, increased our funding by 75% this past year. And Charnel and I just met with them last week to ask them basically if they're going to continue to increase our funding as the cost of providing the dental care does continue to increase. And they seem to be on board. We won't count our chickens before they're hatched, of course, but they'll be very excited about this, and I think they'll definitely be on board to support this initiative to even more specifically address healthcare disparities.
Does MedWorks focus primarily on dental care, or do you cover all aspects of healthcare?
We cover all aspects of healthcare, from medical to specialty, podiatry. We have specialists that come from all different hospitals, systems. We take care of vision, we take care of medical, dental. Mental health is implemented in all of our clinics now, as well as soon to be hearing. So we are vast in array now, and the wealth of volunteers that are able to help into care for all aspects of one's health.
And what is the annual operating budget?
We're a little bit over 800,000.
So it's an amazing operation. Healthcare is is very fragmented in this country, and it's just very hard for a lot of people, A, to afford care, and B, to know where to go and how to get it. And we just really need a total upgrade and simplification and more universal coverage. We just really need a better system. But until that day, you're providing a very significant and important service, and I appreciate your efforts. Thank you.
Thank you for your comments.
May I add my name to support you? Thank you.
Thank you. Thank you, thank you, thank you. So I just want to share real quickly. I've been involved with MedWorks, trying to get the information out in the various districts. Sometimes that's walking door to door to get the pamphlet out. They've come a long way. They probably can mail stuff now, but I used to get out there and volunteer and walk. Of course, I don't have a medical background. I've been to some of the clinics, the eye clinics, and when Director Gillette was still for Office of Homeless Services, and I was just so geeked to tell her about the care that MedWorks, but she already knew because she's an advocate for that group of individuals as well. So they help all of the people that we assist staying at the shelter currently, and I pray that they all find homes. But this, when you talk about dental care, it's like they stated in the video, it's so linked to diabetes, heart attacks, all that. So oral care is the top priority that you really should have. And just to hear their story that they have clinics like every quarter, but the dental clinic they couldn't because they were paying a high price for the dental chairs. So they only had it one time a year. So that's what really spurred me to want to invest, and hopefully some others will invest as well for them to have their own dental chairs, and then they can offer those services to people in our community that need it.
Councilwoman, is this your first interaction with county? Have you received any other county funds? Or
They haven't. There are some conversations in terms going forward, possibly our children in the DH have gaps. They have a dental chair that they've never used, and so they're not getting dental care. So not being paid by anybody, and those are specific gaps of specific kids, because once they come in our care, they're not on their parents. So there are future discussions in regards to that just came on board, because we've been working on this for a long time now. So
yeah, there is one source of funding that we have historically received from the county, which is dating back to a program the county used to run called CHAP, Cuyahoga Health Access Partnership, which was a partnership with the county, had launched with Sabrina Roberts. And I can't remember how many years ago now, maybe 4.
come up and give you a lifeline if she want. She can
Hiding
give
back
you a
there.
lifeline.
I'll let her describe the how CHAP and MedWorks came together and the funding related to it.
Good afternoon, Council. Sabrina Roberts from the Office of the County Executive. Yes, we've had a partnership with MedWorks for over the past decade, not funding, but the past decade. The Cuyahoga Health Access Partnership was something that was stood up by the county, a navigation program. We then, hospital systems around the county, we were working in a collaborative, asked MedWorks to take on the back office of navigation, so we would kind of get out of the business of helping run it. They graciously agreed. Funding was raised by philanthropy and city, county, and then they were kind of taken over by MedWorks. For the last 6, have to go back in my files, I would say at least 6 years, 45,324 comes out of Health and Human Services, and that is to support the navigation, the culling and coordination of their NEO Council, where they get navigators from around Northeast Ohio together to work in sync. They have been lauded by the federal government. Secretary Burwell did visit us during that time to say kudos to us as a community. So they took on all of that work. And so with that, we fund them for $45,324 to do that and then work in our jail to connect folks 30 days out. There's been a languish with that because of COVID, but they want to start that back up soon. So long history there.
Thank you.
I just got a little one. Thank you, Madam Chairwoman. Since you're so good and you ask no questions, how about people that have the means, they come in and want to get it done because they're cheap? I don't think they should be allowed.
No.
No, I'm just saying, it's for the people that need it, right? I'm just wondering if that's.
You know, it's a question that has been asked since the first days we started this organization. And when you come to an event, look, the whole idea is healthcare made easy, right? The hardest part of our patients' days may be getting out of bed, let alone finding the paperwork and all the requirements they need to make an appointment. So the whole reason this works is it's healthcare made easy. You can show up, roll out of bed, you don't even have to tell anybody you're coming, and you're going to be seen. That's why the system works. And the downside of that is we're not asking any questions. So can people take advantage of the system? The answer is yes. Have people historically over the past 15 years taken advantage of the system and come get a free pair of eyeglasses or see a doctor because they in their own minds decided they can't afford their deductible? Yes. But the idea is it's such a small fragment of the people we serve. And if we started asking questions on proving income, the whole thing breaks down. So that's our secret sauce. And what comes with that is occasionally individuals likely decide that they are in need of care and they deem some financial distress, and we see those people too.
And through the chair, I was just thinking like you were the director sitting there giving the people, are you kidding me? Look, just to guilt them out of there.
There has been a clinic where I've seen some, people show up that probably didn't need to be there. It is rare, by the way. I can tell you if you came to a clinic, you probably wouldn't see those people, but over the past 15 years, it happens occasionally, and we have trained our volunteers. We don't make judgments. We look the other way. For whatever reason, they deem themselves in need.
Sounds good. And that was just more curiosity and trying to get my hand around it, and your answer was exactly what I thought it was going to be. There's more good in the world than selfish.
Councilman Miller?
Yes. Could you say a little bit more about your process of helping people find a permanent medical home and who you refer them to and how you have access to physicians that are willing to take on patients and how that process works?
Sure, I'll start with the latter of your comments. How we actually get medical providers to volunteer is the hosts that we choose, for example, Otis Moss, Otis Moss. We all usually pull for the host to gather their medical professionals within their outpatient clinic or whichever location they're at to be at the clinic. You know, the trust is the largest barrier for the health system. And we feel that if a patient is seeing a provider within their community that they live in, and they have started to develop a relationship during that visit in a MedWorks event, that brings that connection together. Our navigation team is always on site for all of our clinics. They connect patients to medical homes that the patient may request, or we feel that would be a great fit for them if they don't have an option or a knowing of where to go to see someone. Our navigation team brings those patients in, they give them ideas of where they can be seen, what the follow-up care would possibly look like. If they have questions, our navigation team is always there to answer any questions, as well as take phone calls to help with any other wraparound services, including childcare, HEAP, as we noted, we noted, and SNAP.
Do you have any statistics on what percentage of people in Cuyahoga County have a particular physician that they're connected with to coordinate their medical care?
No, but that's something that we would love to start to begin to pull those metrics to understand what that looks like.
And I just wanted to add that one of our goals for the upcoming year is to track the number of people that we refer to an FQHC or another primary medical home, to start to track how many people actually follow up and, you know, have a primary medical provider as a result of a MedWorks clinic. Many of our FQHCs that are on site at our clinics and or that we host our clinics at are willing to share that information and are already tracking it because they want to know where their patients are coming from. So we are going to begin to gain a better understanding of how many people we are actually connecting with primary medical homes in the upcoming year.
All right, I'd like to make a motion to move this to the full council under second reading. Is there a second?
Second.
Okay, it's
And Madam
been
Chair, I'd
moved.
like to have my name added, please.
Right, it's been moved by Conwell.
Mine, Madam Chairwoman, that's a cool thing.
Been moved by Conwell, seconded by Sweeney, and all the committee members want their name added. You'll have to ask Cheryl, but I'm sure she'll be on board. Just to let you guys know, MedWorks, so second reading, it's been passed out today. It'll go to committee of the whole council on September 26th. That'll be a second reading, and then it'll be
October 10th.
October 10th will be the
Budget day.
third reading, and staff will reach out to probably Rosemary and keep her in the loop of, want to come the final night. On the second reading, we just read it into the record. Nobody really talks about it. So if you want to come the final night on October 10th. And
Go woohoo.
so thank you very much for what you do for the community.
Thank you. Thank you for your time.
Did we vote on it?
Oh, we voted. Oh, no, I've moved it. It was seconded. All in favor to move this to the full council under second reading, please say aye.
Aye.
Thank you, Dale, catching me. Madam Clerk, if you could read the next item into the record.
Resolution 2023-0232, awarding a total sum not to exceed $100,000 to Hazelwood Court LLC for the Hazelwood Court Senior Housing Project from the District 8 ARPA Community Grant Fund.
All right, please state your names for the record and present.
Hi, my name's Mary Ellen Melcher. I'm with Pearl.
Allison Salopek, I'm President and CEO at Jennings Center for Older Adults. So thank you so much for giving us the opportunity to be on your agenda and talk to you about our need. Mary Ellen will get into the weeds on it. I just wanted to give you a sort of high-level overview. I believe that each of you received a little folder, and in it, we have our apartment building that we're discussing today. So Jennings is serving older adults in the community. We're currently on 4 different campuses and are in the process of completing a construction apartment building for low-income seniors in Maple Heights.
How many units?
There's going to be 53. And we just had our first of a little series of community meetings where we're finally getting to pass out applications and let people know what the rents are. I put those for your information so that you know what we mean by low-income seniors and then what the subsequent rents would be or will be. And just yesterday in 2 community meetings, we had 75 individuals show up to get applications for the 53 apartments, and we have about 6 other community meetings, which is just one way to do that. So we feel Jennings got brought to the table as a co-developer and then will be the manager of this apartment building. We believe strongly that individuals want to stay in the places that they raised their families, that they've lived, but perhaps the place that they live is not so easy for them to continue to live independently in a place that they feel safe and secure and is well kept. So it's not only about the bricks and mortar, but also what we bring to the table with service coordination and really allowing, I like to say, we sort of bubble wrap people to give them services and link them to the community in ways in which they can successfully continue to age. So with that, we have a specific need that we are hoping that you'll be able to help us with. So, Mary Ellen?
Yes, thank you. We did have a it's not a PowerPoint, it's in a PDF. I thought it was going to be too large to send, so we'll pull that out. So Beacon Grove Apartments, also known as Hazelwood Court, as Allison described. Well, first, let me back up. First of all, I want to thank everyone for allowing us to be here today. Councilman Miller, Sweeney, Councilwoman Chair Conwell, and Councilwoman Turner. We really appreciate the opportunity to sit here and speak today and just share with you a little bit more about Beacon Grove Apartments. So just the development team a little bit. I know Allison explained they are co-general partner, co-developer, and property manager and service provider of Beacon Grove Apartments. Pearl is the co-general partner and co-developer, and we were the general contractor as well. We also had I also listed a couple other professionals that were on the team. HDNS was our design and architect, and Bramhall Engineering was our civil engineer. Just to give a little history of Pearl, I know Jennings was already covered here, but Pearl is based in downtown Cleveland. We are an active developer and builder in senior housing in Cuyahoga County and elsewhere in Ohio and in other states as well. We have been in business for almost 19 years, so we've been doing this for a long time, trying to provide affordable housing to those within the community. Just some development facts about Beacon Grove. This is located west of Thomas Street between Waterbury and Dalewood and Maple Heights. You can see the little site map visual there. We do serve, it's going to serve 53 units. Of that, 45 one-bedroom apartments and 8 two-bedroom apartments. This is an affordable housing independent living facility for seniors 62 and older. And the building itself will be accessible for single-floor living, allowing seniors to remain in the community that they love within Maple Heights. Just wanted to provide an overall snapshot of the actual site as well, just so you guys can see and get familiar with the overall layout of the site. You can scroll to the next slide here. So some of the reasons for our need, we closed this deal about a year ago. Actually, I think that's when we broke ground. We, at that time and prior to that, we were seeking additional resources just to help close the gap on the deal. And, you know, part of one of the reasons we kept exploring additional opportunities to close the gap was we needed to put in a public road just so the community can access the actual apartment building. And I think most people know that when you put in the community road, there's additional infrastructure as well that we need to build up to. And so that was one of the bigger reasons why we were looking for additional resources. We originally put in requests to explore almost $500,000. It was a little over $500,000. And as we continued conversations with the county, we fortunately received feedback that we could, put in a request, and that's where we were asked that it would be limited to a not to exceed $100,000 for consideration, and so that's part of the reason why we are here today. far as overall timeline of where the project currently sits, we are a little over 50% complete with construction. I think it's closer to 60%. We anticipate construction completion to complete at the end of this year. Early January is when we expect occupancy to start taking place. So this is why Jennings has already applicants on their way coming through. And so, the need for next steps is on the building is getting fully leased up and then hitting to perm loan conversion after that. Just so you guys can understand the overall snapshot of the project budget, when we close, this is the snapshot. It's actually a little bit smaller than I anticipated. Hopefully you guys can see it a little bit bigger there, but you can see in red, the financing gap on the deal was a little over $980,000. Which is a little unique for this type of development. Typically, equity investors who purchase the equity in the deal, they typically want more of a 50% liquidity, and this is closer to a 72% liquid deal. And so again, when we were closing the deal, they asked us to continue exploring other opportunities that would be out there to help try to close the gap on the deal.
Can I say
Yep,
something real quick?
go ahead.
One of the things I think is super important to understand is that I'm not sure how many of you are very well versed in low-income housing tax credits, with the 9% deals being very competitive. But around the country, a lot of these projects just have not been built. They kind of walked away from it with the increase not only in the interest rates, but also in the construction costs. I think they were like 35% more with the availability of materials, with the labor, all of that. So those two things, along with, this isn't a driveway. This is, as you could see, the fire department made us do the whole, be able to get a truck around, circle around a whole cul-de-sac that, the apartment building sits at the end of. So there were costs in there but we forged ahead anyway because we saw the need. The community's been extremely supportive of us being there, and, we're not used to letting people down. So thought that would be good background.
Yeah, no, thank you. And just one other thing to add, just with it being 9% tax credits, there are deadlines by which when you receive a tax credit award, you have to complete the project by. That was one of the other reasons why we had to find ways to still close the deal and start construction so those tax credits still stay valid, making sure they're complete on time. Just for the community impact piece, I don't know if you want to add anything to this, Allison, but really, having these resources really helps us. Allows us to have an aging population within Maple Heights to live within an affordable housing community with supportive services. This also helps us have public infrastructure that helps connect the community, connect those residents within the community that they live in. With that, I don't think I have anything else to add to that. If you guys have any questions, please feel free to ask. We do have, obviously, some context here that we included as well.
I have a couple. Why was the age determined to start at age 62?
So with the application itself, at the time that they put that out, they determine, I can't remember what it's called. It's like the AHPA.
Qualified, yeah.
Yeah. Okay. And so they determine whether it's 55 and older, 62 and older, or 65 and older. And we really, the older Jennings feels like we can get that. By the way, 55 and older, years ago when we built our first one, seemed like older adults to me, but as I've surpassed that now, it's like, that's not really older adults. But that's where we landed at the 62 at this point.
You could be like me, I'm stuck at 21.
Yeah, I think it should be 75 and older, whatever they say.
Is it near transportation, this housing development? Is it, we have age-friendly now with our Department of Senior and Adult Services, and so we're really looking at placement matters when
Right.
we talk about our seniors, so.
So the Maple Heights Senior Center, which also has transportation, has been a true partner, community partner in this. As a matter of fact, one of the community meetings yesterday was at the senior center. So they're not just the public transportation right there on Broadway, which is not too far, but for the folks that tend to live in the apartment buildings that we have, they really need to be picked up at the front door as opposed to close to public transportation. So that infrastructure is there with the community center, the senior center, excuse me. And along with that service coordinator, things like shopping trips and just access to other kinds of transportation, the rapid response kind of transportation, the service coordinator would help them if they required that.
Any annual fundraising efforts that
So Jennings does do fundraising all the time. Matter of fact, we just had an annual fundraiser this past Friday. But typically, the funds that come from that are going to the folks that cannot afford to pay for their services, generally speaking, in our nursing home, as well as our assisted livings. But Jennings, has been actually linked up with a large company that is now kind of downsizing their real estate because so many people are working at home that we're going to be getting donated furniture for this apartment building and donated fitness equipment. So kind of scraping and asking everywhere that we can for that support.
Well, thank you. Any questions from my colleagues? All right, seeing none, hearing none. I know this is our council president in his district. He had a lot, so I'm sure he would, his name is on there probably as a sponsor. And so as you heard me state to the other organization, it would be September 26th. Once we vote, it should go to, it'll be in second reading at the council meeting on September 26th, and then the third reading will be October 10th. So please come out that evening and support your effort, and that way you'll be able to see the council president that steered it in our direction. So I'll take a motion to move this forward.
So moved.
Second.
Moved by Sweeney, seconded by Miller. All in favor to move this to full council second reading, please say aye.
Aye.
Thank you,
Thank you.
ladies. Well,
Thank you.
I would like
Thank
to
you so
add my
much.
name.
okay, and Councilwoman Turner would like to add her name.
No, you're good.
Okay, thank you so much.
You're welcome so much.
Resolution 2023-0246, authorizing a payment to the Mount Sinai Healthcare Foundation as fiscal agent for the Lead Safe Cleveland Coalition in the amount not to exceed $800,000 for operational support for the period September 26, 2023 through December 31st, 2023.
All right, thank you. Please state your name. Just to let the committee members know, we are assisting Councilwoman Stevens. This should have originally been in her committee, so she asked that it be sent to mine. So please help me in listening to everything that I'm not probably privy to. So go ahead.
No problem. My name is Brian Edwards. I'm the loan portfolio manager for the Department of Development. And I am here to just present. We have some guests here. Madam Chair and honorable members of the committee, it's my pleasure to be here to present this. And we are following the same fashion we have in 2022, where the Department of Development and the Office of the County Executive are jointly making a recommendation to provide operating support for $800,000 to Mount Sinai Healthcare Foundation as the fiscal agent to the Lead Safe Cleveland Coalition. The funding sources will remain the same as they were last year, where $300,000 is coming out of the Economic Development Fund and $500,000 is coming out of the Health and Human Services levy. What the request coming in for was because Mount Sinai Health Foundation serves as a fiscal agent on behalf of the Lead Safe Cleveland Coalition and the coalition's Lead Safe Home. They are requesting this on behalf of that. The coalition is a 500-plus member public-private partnership formed in 2019 with the goal to reduce and ultimately prevent childhood lead poisoning over time by proactively creating lead-safe homes and child care spaces. The funding from the county will support the coalition's Lead Safe Resource Center, the community's one-stop shop for lead poisoning prevention. This resource center provides lead safe certification navigation, workforce development, resident services, community outreach, and education. Through workforce development programming, training and career development, and other items are available to residents to fill the need for certified lead remediation work that is in high demand. There's a do-it-yourself or DIY property owners are also trained in lead safe work practices. The Lead Safe Hotline helps residents navigate resources for lead poisoning prevention, and their Lead 101 and other community education will continue through a series of education trainings, events, opportunities at the Resource Center and throughout the greater Cleveland community. All are welcomed in the district they serve, and prior support has been given in 21 and in 22 in the same amount. And this, again, is a joint recommendation of the Office of the County Executive and Department of Development to move forward. And with us today, we have members of the coalition who I think would be best suited to answer the questions you have because it's more granular into what they're doing. I'd like to invite first Mr. Daniel Cohn from the Mount Sinai Healthcare Foundation. And are there any questions for me before I step away?
Well, I'll wait until I hear everything, then I'll know.
Thank you, Madam Chair.
Good afternoon.
Good afternoon.
As Brian said, my name is Dan Cohn. I serve as Executive Vice President and Chief Strategy Officer with the Mount Sinai Health Foundation, and I'm here with a group of colleagues who maybe if you either stand up or raise your hands, I'd really appreciate it. Ayanna Blue Donald with Enterprise Community Partners, as well as her colleague Wynette Cheers. Patrick Kenny and Michelle Moore with CHN Housing Partners. Zach Coffer and Kevin De Leon with Environmental Health Watch. And for moral support, Ken Surratt with the United Way of Greater Cleveland. As you heard Brian say, the Lead Safe Cleveland Coalition is a cross-sector public-private partnership with more than 550 members spanning across 150 agencies. The coalition comprises advocates, parents, residents, property owners, lead safe workers, local government, health systems, housing organizations, academia, funders, you name it. We're all under the umbrella, and despite our many, many different backgrounds, we all share one goal, which is to prevent children from being lead poisoned. We believe no child should ever be lead poisoned in Cleveland. As you probably are aware, lead impacts everyone, and that's why we all feel so strongly that we need to collectively take ownership over addressing the issue. Lead exposure impacts educational attainment, criminal justice, housing stability, workforce development, and the costs of lead poisoning are staggering to our children, to our families, to our communities. In short, lead poisoning robs children of their God-given potential. We're grateful to be with you today, as we have in the past. Thank you to County Council, to the County Executive, Chris Ronayne, for working alongside us over the last several years, and for your commitment of $4 million over 5 years to the Lead Safe Home Fund. We're grateful that we've raised across public and private sector partners almost $115 million for the Lead Safe Home Fund. And Mount Sinai proudly serves as one of three fiscal agents. We hold about $31 million in both public and private sector contributions. The fund is proud to have support from actually all levels of government, which is a surprising and wonderful thing to say. The City of Cleveland, State of Ohio, U.S. Department of Housing and Urban Development, and of course, Cuyahoga County. as well as anchor institutions throughout the region, including all the major hospital systems, all the major foundations, nearly every regional bank and CDFI, and even a statewide health insurance plan. As fiscal agent, and by the way, I should mention, Mount Sinai, by way of serving as fiscal agent, takes no administrative fee. We provide fiscal agent services in kind as part of our contribution. In addition to a financial contribution, we put in a significant amount of staff time and energy in helping to manage the Let's Safe Home Fund. And we work closely with the Coalition's backbone agency, Enterprise Community Partners, who, as I mentioned, is here behind me. Enterprise is an all singing, all dancing, seemingly never sleeping crackerjack team that serves as the behind-the-scenes operators of the Coalition and managers of the Let's Safe Home Fund. This community no doubt owes a huge debt of gratitude to the entire Enterprise team for their tireless effort, and I'm happy to hand things over to Ayanna Blue Donald, Vice President and Ohio Market Leader of Enterprise, to share a little bit about our plans for the next installment of the county's funds, should they be awarded. Thank you so much.
Good afternoon to the chair, to the council people. Thank you for having us here today. It is true.
Excuse me, Ms. Donald, if you could state your name for the record, please.
Yes.
Thank you.
Thanks. Ayanna Blue Donald. I serve as Vice President and Ohio Market Leader for Enterprise Community Partners. Enterprise continues to proudly convene and manage the Let's Safe Cleveland Coalition, which includes managing the Let's Safe Home Fund, a first-of-its-kind support to property owners and families in lead safety. When we say the Let's Safe Home Fund, we're really referring to all of the resources, programs, and services our city needs to make the lead safe certification feasible and to successfully prevent lead poisoning. The fund includes grants and loans for property owners, workforce development, community education, support for families, and recently expanded to create lead-safe childcare. I'd like to thank again, as Dan did, the council for your ongoing and unwavering support and investment into Let's Safe Cleveland. When we launched this coalition back in 2019, it feels like ages ago, but really wasn't that long ago, we committed to work toward no child ever being lead poisoned. As a reminder, first, we supported the passage of the City of Cleveland's Let's Safe certification law. This was very groundbreaking. It just how much time and effort it took to put into getting this law passed. But it's also really formidable to say that although we are called Let's Safe Cleveland Coalition, we also support other communities in this effort. Really happy also to say that Cleveland Heights has followed suit in implementing their own certification law, and we were a part of that consultation and collaboration in helping them get across the finish line. So really encouraged as well as we hear rumblings of other communities in our county that are looking to do the same. Thanks to investors, including the county, the Let's Safe Home Fund now offers a variety of things. A spectrum of lead-safe home loans and grants for Cleveland property owners to make lead-safe repairs with grants up to $12,000 per unit. A lead-safe resource center, which these funds, if approved, would support, to provide lead-safe certification navigation, workforce development to everyone in the county, resident services to everyone in the county, community education and training to everyone in the county. Lead-safe childcare grants, which was recently added in 2023 to create lead-safe childcare homes and centers. We just wrapped up the third year, the 7.5-year Let's Safe Home Fund budget, which ran until August 2023. This county award will specifically support the Let's Safe Resource Center in year 4 of our 7.5-year plan, if approved. Now, what do we aim to achieve in the year 4 with these funds? Well, we host 50+ community events, host at least 72 trainings. That includes classes and seminars, lead 101 trainings, lead safe landlord training, and lead safe tenant trainings as well. These will be both virtual and in-person community-based convenings. We will increase partnerships to activate events and activities with city and county council, CDCs, community engagement specialist officers, schools, housing organizations, and healthcare organizations and hospitals. We aim to make 5,000 unique landlord and community touchpoints in the specified zip code rollout and code enforcement areas, 1,000 residents, property owners, either visiting or engaging the resource center based on the needs that they have. And we do track that by zip code. It is also in-person appointments if you need that as well. It includes one-on-one engagement, right? Really what people need, and RRP training for landlords. We do offer or maintain bilingual and Spanish-speaking staff to provide on-demand Spanish translator services. There is a capacity to handle a target peak call volume of 5,000 unique calls. We do track in a database all referrals based on types of the resource center, just so we can get an idea, especially when we have new communities that may be coming on board, or what the needs are in our community and how we need to flex to address those things. On a monthly basis, at least 30 property owners will work with Environmental Health Watch in the Resource Center. We monitor all the needs of our workforce development. The people that we train are lead-safe workers. That's something that's often goes bubbled up to the top when we think about lead issues in our community, are actually the workforce. And we're proud to say that we work with them, monitor their needs, and reevaluate just our process and criteria to make sure that we're getting enough people into the pool and into the system. We have implemented a vetted worker grant pilot program, which targets at least 50 units and properties. So we make sure not just only to train the workforce, but we have developed a pipeline to say, okay, we've given you the classroom training, but we also want to know that you can deliver the services in a real successful way. So there will be hand-holding and training to actually teach people in a unit, in an actual property, how to do interim controls and repairs. We will conduct at least, so there's a lot that this funding will support, conduct at least 24 renovation, repair, and painting classes at a minimum, with room to ramp up based on the demand that is needed here in the county. We will conduct at least 2 clearance technician trainings and conduct 6 vetted experience training, that's RRP and CT, the clearance technician training. And we can also add more workshops if the need is identified. This is not a comprehensive nor a final list of what we can achieve at the Lead Resource Center, but this is the baseline of what we hope to achieve over the following year, in year 4 of our Lead Safe Home Fund administration. The last update that I would really like to share is honing in on how we've been flexible throughout this time to continue to add capacity to the whole overall Lead Safe Home Fund system. So we are adding on 3 additional grants to property owner administrators to help get more grant funds out into the community quicker, and additional workforce development administrator to create more access and lower cost clearance technicians throughout the community. And so these will be working specifically with the community development corporations throughout the city of Cleveland. We do or anticipate releasing 2 RFQs to identify administrators for lead relocation assistance for families facing displacement due to lead before the end of the year. We previously released one earlier this year and did not receive last year and did not receive enough applicants. So we're revamping that because that is a critical missing point to make sure that families that are affected by lead have somewhere to live. And we will be releasing another RFQ for screening and testing to increase the number of children that are tested here and throughout our county. I'd like to give just a welcome invitation to everyone here and everyone that may be watching. As was mentioned, we are a 500-member plus coalition. We appreciate partnership from all levels and hope to work closely with everyone. We invite everyone, community members, council members, et cetera, to our next coalition convening. That will happen next Thursday, September 28th, from 9:30 to 11:30 at the Cleveland Clinic, Langston Hughes Community Health and Education Center. And we will provide even more information and share a full update of what we've been up to over the past year. As always, I do have some collateral. What we've been working on also this year is a rollout. You may, as you drive through the community, have seen some billboards up that says it pays to be lead safe. They're kind of everywhere. We, of course, have targeted in some hotspot areas where lead poisoning is an issue, but I have some collateral here if you'd like to take a look as well, or if you would like to have more information to pass along to your constituents, we have that. We have a website, www.leadsafecle.org, where you can find all of the information that I mentioned, the schedule of trainings and such. Our Lead Safe Resource Center hotline for everyone that's listening is 833-601-LEAD or 833-601-5323. And finally, there is so much information we always have to share and data and reports about the investments that everyone has made, including the county. And that information can be found on a public Lead Safe Cleveland data dashboard that was created in 2021. I won't give out the long web address at the moment, but if you are interested, we can share that information. And I'm sure if you Google it, you'd be able to find it as well. We have quite a few partners here, and if there are any questions through the chair to the council members, I'd like to entertain those now.
Yeah, I had a few, but I'm gonna open it up. Does anyone have any? Councilman Miller.
Thank you very much for your presentation, and I continue to believe that lead paint poisoning is one of the most serious problems facing the city of Cleveland and the country. And I think that a lot of work is being done, and still more needs to be done. And my first question is that as of the last report I had seen, that things were moving relatively slow in Cleveland in terms of getting houses certified, and that something like only 20% of the houses are certified as lead safe, and these were mostly houses that would have been safe anyway. And the question is whether anything has happened in the last year or so to move the needle at a faster rate on getting homes certified.
Through the chair to the councilman, yeah, I think we still are trending, and Wynette can agree. I think it's still around 20%. I probably would not necessarily agree that those are homes that would have been classified as lead safe anyway. Keep in mind the lead safe certification law is any home that was built prior to 1978. Those are automatically assumed to be a lead hazard, as lead paint is highly likely to be present in those homes. And so all of those properties have had to undergo some level of a lead clearance test and or interim controls or remediation to make sure that they pass a test. But what has happened in the last year is really ironic as we sit here today and is listening to the wonderful presentations before us. There was an article published in, I think it was Cleveland.com, that highlighted the city's moving forward on 50 prosecutions with lead hazard control orders. That is monumental in the sense that the city has never prosecuted property owners that have been found to have positively poisoned a child. So this, I think, is a missing link. Keep in mind that the Lead Safe Cleveland Coalition for surely was started to help the city along with the lead certification process, was a carrot and stick approach. We have around $115 million of carrots in a variety of different ways: workforce development, grants, loans, resource center, et cetera. But that stick has been a missing portion. So really, really pleased to say that, I mean, we work hand in hand with the city of Cleveland. There have been some hurdles, and I know it probably better than anyone else, has been previously sat in that role at City Hall, how many hurdles there were before the Department of Building and Housing to be able to enforce such laws. So really pleased to see that they are making a stand and a show and an effort by prosecuting 50 filings, criminal prosecutions in housing court that was just released today. So I think that will greatly move the needle as we've been working a carrot approach for the past 4 years to finally have that stick in a really meaningful way. I think will substantially change the landscape of what it looks like and getting more people to actually certify their properties as lead safe.
Madam Chair, how much progress have we made in getting to the point where parents in Cleveland can feel reasonably confident that they can raise young children in Cleveland and have them reach school age without being lead paint impacted?
I think Through the chair to the councilman, I think that's a really interesting question because, the impact of the coalition's efforts on lead poisoning rates is still really being vetted out, in the sense that the coalition was started in 2019, the law was enforced and really enacted in 2021, so we're only a couple years at this. So there has been a marginal decrease in the amount of children that have been lead poisoned as tracked by the county, but also keeping in mind the pandemic has happened during this time as we rolled out, right as we were rolling out all of our kind of resources. We were in the height of the pandemic at a time when children were at home. 100% of the time they weren't in school. So when we think that lead poisoning is a public health crisis with a housing solution, you're in your home where people have been, mostly children have been mostly lead poisoned, that it may be anticipated what we see in the next year as far as data from this year or data from last year, as far as children being lead poisoned. But I think that families now understand a little bit more. We're out everywhere we can to say how many resources we have available. So if people are coming against obstacles with their landlords, or obstacles as far as finding funding, or obstacles trying to figure out how do I even tackle this problem, that's what the resource center is there for. I think the word is out in the community that there are resources available. Now, how secure families feel about that, I think, that would have to be a survey that we have to find, but I would like to believe that we're doing a great job in getting the information out and really trying to bridge that gap that has happened for years of people really not knowing where to go to and where to turn.
I know.
So, Madam Chair, if a family is renting and not able to get the cooperation of their landlord to deal with lead paint hazards, are there things that parents can do on their own to make their units relatively safe?
There is, and I want to call up either Zachary Coffer or Kevin DeLeon to really talk about that from the eyes or the standpoint from Environmental Health Watch and the Resource Center, and the type of questions they may receive from tenants and the services that we can offer.
Good afternoon. My name is Kevin DeLeon. I serve as the co-director of programs at Environmental Health Watch, which houses the Lead Safe Resource Center. And so I am a licensed lead risk assessor, so I've done trainings and actually have worked out in the field. So I have hands-on experience with conducting some of the exams and talking to families and seeing homes in disrepair or in good condition. And one of the major tips that we tell families in our Lead 101s, as well as what I used to do when I used to go in homes, is to tell folks to clean. Cleaning is the main thing you can do as someone living in the home, to help keep your family safe, because the source of the lead paint comes from the dust that is created from the chipping and peeling paint. And so as long as you can maintain a cleaning schedule where you're cleaning floors and horizontal surfaces in your home, that greatly reduces the chance of a child getting lead poisoned. And so many of our education presentations that we do for the community, that's what we stress, is doing cleaning educations. As a matter of fact, when people show up to our community events or education sessions at local libraries and at our resource center, we raffle off vacuums and cleaning kits to promote that. And these vacuums come with a HEPA filter, which is specific to cleaning lead-based paint dust or hazards.
Okay, thank you very much. That's encouraging. And final question, there are communities in Cuyahoga County outside the city of Cleveland that have significant lead paint problems. Is any progress being made in communities outside of the city of Cleveland, and to what extent is your coalition involved in that work?
Through the chair to the councilman, Absolutely. So the Let's Safe Cleveland Coalition, I think that that's also one benefit. If I take one step back to enterprise community partners leading this work, we're known in our community as conveners and collaborators. I have a director of state and local policy. So generally speaking, this kind of work and encouraging other communities to establish such laws, et cetera, would fall under the policy work. So not only is it a part de facto of us administering the Let's Safe Cleveland Coalition, but also just a part of the work that Enterprise continues to do to make sure that people have safe, affordable, and healthy homes. So we have convened and collaborated, counseled, so to speak, Cleveland Heights when they were working through their legislative process, and happy to say that they've implemented a law. I believe Lakewood, you can speak directly to. Yeah.
Sure. Yeah. And, Councilman, I'm taking off my Mount Sinai hat here a little bit and saying, as a Lakewood resident, I happen to be board chair of the Lakewood Community Services Center, and housing conditions in Lakewood in particular are issues that we really care about. And so if there are opportunities to collaborate with you and think about ways that we can improve housing conditions in Lakewood, I'd love to connect with you offline. But anyway, I'm sorry to insert that.
And then also, as we continue to brainstorm with some of our community partners, such as the county departments of development, when there are opportunities, other funding opportunities for other cities and municipalities, we do get called to the table to brainstorm and provide best practices for them about what works, what doesn't, et cetera. And as communities, if they come online and become, to the point where they're ready to do a Let's Safe Home Fund, we are ready and willing to step up to the table. We do advocacy also on the state level to make sure that there's funding available, as the state released $150, I think, $1 million that's available throughout the state to a variety of different counties. I like to say that some of our advocacy and just also the example of what Let's Safe Cleveland is and the Let's Safe Home Fund of what it aims to do and what we have accomplished was highly influential in that. And other conversations that are actually happening at the federal level, we are involved in those conversations to bring just really a spotlight on this work and a need for other funding across the country for this funding to happen.
Okay, thank you.
I'd like to move this legislation. I do have 3 questions, but due to the interest of time, and we still have things on our agenda, if you could give your contact information to Sharon so I can call you and ask my 3 questions. But if I can call for a motion to move this to the second reading to the full council.
So moved.
Second.
Been moved by Turner, seconded by Miller. All in favor, please say aye.
Aye.
Please add my name. Thank you.
Thank you for your support.
Sharon, can you add all 3 of us?
Yes. Our next item is a discussion item. It is a fiscal appropriation and a cash transfer related to the establish the interim foster care housing facility capital project.
Good afternoon, Madam Chair. Matt Reimer with Department of Public Works, Facilities Design and Maintenance Administrator. And since this was an fiscal agenda item to establish a capital project, I thought I'd start. And I do have a short presentation to accompany, and then Director Merriman will join me. So the project is to establish a 16-bed residential component at the Metzenbaum Center, which is our Metzenbaum facility located at 3343 Community College Drive. That building currently is a 47,000 square foot facility, 2 levels on an almost 6-acre site across the street from Tri-C main campus and next door to the former Jane Addams High School. The project that we are intending to construct is the interior renovation of the upper level D and E wings, which are highlighted on the presentation shown on your screen. This will provide for lounge space, staff space, nourishment space, and bedroom space for 16 beds. And also providing the appropriate reclassification of the occupancy classification of this building to support that residential function. The past use of this building, these were residential wings before they were modified for juvenile court use in the past. And part of the project components will include not only the interior renovations, but we'll also be providing fire suppression to the building, which is coming off of East 35th. which is also the other square shown on the aerial picture there. We do have a designed project option to also add an interim accessible ramp off of D-Wing, which goes to the grassy area and then to the parking area within the project area marked. Our goal here is to provide the capability to DCFS to provide as many tools in their toolkit to meet the placement crisis that they are facing and provide an appropriate residential alternative to the Jane Edna Hunter complex, which is consistently overburdened with the number of children that the department sees and has to find nights for them to stay before placement. And with that, I have a few other slides to go over the physical attributes of the project, but I'll just pause there and ask Director Merriman to give his perspective on the project and the need.
Good afternoon, David Merriman, Director of the Department of Health and Human Services. I first want to thank Public Works for their leadership on this project and bringing forward this item. As Matt Reimer stated, yes, this is an important project for us as we respond to the placement crisis that is affecting Cuyahoga County and child welfare agencies throughout Ohio and the country. We are working concurrently here. We are exploring the procurement process that yielded several proposals that are in review. I don't want to speak too much about that because that's an open procurement, but I think the reality is we are in dire need of placement resources for the children in our custody, many of whom are awaiting placement in the Jane Edna Hunter building. This option that's before you today would present us with placement resources in our direct control and proximity. We find that to be advantageous to many of the options we have now and the need at times to take children around the country for placement. Many of those children are without placement and they end up staying in our building for longer periods than we think is appropriate, but on occasion we have no other options available for them. We see this space as returning it to its initial form. It was used as Mr. Reimer said, as a facility for a long time. The space is suited and adequate, in my opinion, and it has additional green space and other resources available to it. A last point, we work very closely with the juvenile court. They are partners from us on this project. We will continue to work with the juvenile court regardless. They do have programming in this space as we speak that provides youth from Cuyahoga County with services such as day reporting and other support that could be beneficial to us if we coordinate. We believe many of the youth that in fact could be staying in this facility could also be involved with the juvenile court, as the frequency of youth in our building is generally tied to multi-system youth that are involved with the juvenile court, with the Adams Board, with the Board of Developmental Disabilities, and DCFS. So we see this as an important step forward. We're grateful again for Public Works and their leadership on this, and I'm going to turn it back to Matt, but I'll be standing by if there are questions.
Thank you, Director. If I could ask the clerk to go back to the presentation, I'll just go through at a high level the physical attributes of this and then reserve the time for questions. Trying to advance a slide, I apologize. Sorry, that remote's not working, Sharon, or I'm doing something wrong. Is there any way you could advance it for me? Yes. So there are hard copies as well available to committee members, but again, this would take on 2 wings in the upper level of the Metzenbaum building. Each wing would have 4 sleeping quarters with 2 beds each, as well as lounge space, staff space. These capitalize on the existing showers within the facility, which we would modify for accessibility. But again, these were former residential wings in the past. We also are adding a fire suppression main that would support the building and is a requirement of the residential function of this conversion. We have designed an ADA accessible ramp coming to the D-Wing, and while the building does have a 2-stop elevator, it is not in a location that would be the most functional for this operation, so we also want to provide the interim ramp to, again, provide other options. And as Director Merriman mentioned, the closing picture that I have on the slideshow was just, you know, it's a picture that's in stark contrast to the amenities that Jane Edna Hunter has, which is just the parking lot and then the sidewalk. You know, we have excessive green space, recreational courts, and other amenities at Metzenbaum that can really, I think, help you know, de-escalate a lot of the behaviors that we see at Jane Edna Hunter. And I'm not speaking to that from to overstep the HHS team, but just from what we see from Public Works and what we respond to. So with that, I'm happy to answer any questions on the project and the program and on schedule and intent.
Okay, I know this is a discussion, but I don't think we fully vetted, at least conversations with council in terms of finance and Health and Human Services Chair has not been adequate enough in terms of this. Now, I'm not going to say we're blind to knowing that we're moving in the direction, the administration is possibly moving in the direction of Metzenbaum Center, but there's other outliers out there, like going to see other models out of town. I kind of let the RFP move forward. So that wouldn't hold up that process while we had more discussion on this. So I would say, and I'll let Councilman Miller speak for herself, but I would probably need I don't want to hold up the process, but I'll see what Councilman Miller says. Definitely need to have a meeting, sit down with Councilman Miller and myself in terms of this. And I haven't been shy of sharing my thoughts and opinions with Administrator Merriman going forward with this Metzenbaum. Just for the record, not anti, not opposed, but I want the county to make a wise decision in terms of us moving these kids, not one office building to the other. And in looking at some of the details of the money and what it's cut out for, it's a lot of the system kind of things. I don't really see any amendable things for the kids, and my whole thing is about kids. So I'm going to turn it over to Councilman Miller and see what his thoughts are.
So the first question I have is I presume the county would run this facility, and what would you see as the typical length of stay?
To the councilman, yes, I think this is, the proposal at this point is that the county will own the facility, and one of the elements of the procurement that is closed and is still in review is that we seek outside participants to consider on-site services as well. I don't really want to get too deep into an open procurement at this stage, but I think we're considering both options in this, whether it's a county operated or it's an outside entity operated. Regardless, the county will own the facility, so this will be a county facility. And yeah, I think it is important to also acknowledge that we've had the state out many times, and in fact, as we were initially contemplating the opening of the T-Suites program, we brought state officials that are charged with licensing to look at the space, and we gave them the option that we were considering whether we do a procurement and bring a space on quickly with an outsourced location, or we invest in preparing this space that we had available in Metzenbaum. And I think we heard very good feedback that if the fastest route to address the kids in the building and the placement crisis is to develop an outside partnership, that's a pretty good option, and that's what we did. But that never stopped us from pursuing this option. That T-Suites option has produced 8 beds. We have 8 kids staying in T-Suites. I think what this will produce will be 8 rooms and up to 16 kids. I'd like to say that this would be short-term and that youth should be able to be placed in a more suitable option as quickly as possible. One of the things that we found is that there are some very special needs kids that are coming into care. Many of these youth have very significant mental and or behavioral or developmental disability issues, and it's just taking us at times months to find a suitable placement for them. Some of these youth are either staying within T-suites or on occasion they've stayed in our building longer than we'd like. We think this is a better option for them to stay in a space that is designed for residential services while we continue to pursue a more appropriate placement. It's a long-winded answer of me saying it depends. It will depend on the kid, on their conditions, their needs, and the availability of a more suitable placement.
And Director, do you have an anticipated start date for these renovations to be completed and services to be started?
Through the chair to Councilman Miller, our Public Works mandate is to try and be done with these two interior spaces so that they can begin operating in the new year.
And is all the work going to be done in-house, or would there need to be a contract for outside services to be provided to do the parts of the renovation?
Through the chair to Councilman Miller, the primary general contractor will be the County Public Works Trades. We are a licensed general contractor in the city of Cleveland, as well as a licensed plumbing and electrical contractor. We will be relying on services provided by some of our on-contract vendors for our HVAC contract services. And we'll also have several procurements that will support the project that will likely be in the realm of the Board of Control. Those are going to be our flooring for the project, some of our tile work, our doors and hardware, and some of the other materials that our trades will need to execute the construction. We also have a specialty contractor through our road and bridge team that is going to be performing the fire suppression line addition from East 35th to the building. That's also a separate bid effort.
So, the item that's before us is the fiscal agenda appropriation. If that item were approved in the fiscal agenda at a future council meeting, could work then proceed, or is there some other approval of some contract or something else that would have to occur before we could start?
Through the chair to Councilman Miller, no, it would not delay starting. In fact, we have started with some of our selective demolition of the two spaces. It housed an underutilized section of the juvenile court team, and we were able to easily relocate them. And some of our master contracts that we already have in the Public Works realm have supported our advanced procurements. So this, the addition of the project appropriation would just go to charge back those expenses in progress. So that effort could continue if approved without delay on processing of the fiscal agenda item. Hope that answered your question.
So, are you saying that we've already started construction on this?
That is correct. Through the chair to Councilman Miller, yes.
So, I would express concern about that. I think that that there should be consultation with Chairperson Conwell and with the council president, and that there should be an understanding that we want to go in this direction before the work begins. You know, I think that the case you've made is compelling, but I think that the council should be consulted. So that would be my comments to the chair.
All right, Councilwoman Turner, do you have any?
No, I agree.
All right, and since this is just a discussion, I believe it will, needs to be voted on.
Can I just address a part of Councilman Miller's concerns, if I may?
Yes.
I think I certainly understand the perspective about consulting with council. I think we're all committed to that. But I also just acknowledge, number one, this placement crisis is requiring us to act with urgency. And I think we are months away from this project being anywhere near a complete state. And so there are a lot of decisions to be made. There are a lot of elements that are still being worked out. But I think some component of this work began last year when we were in the midst of at the start of the placement crisis. And some of it was a recognition that we had facilities and space that could be used to alleviate the problems. And the decision was made to start working on it, preparing that space, preparing the project. And I think in that way, Public Works followed, the direction to help us start to prepare the space. I do also want to point out that, unfortunately, that the placement crisis has not been ameliorated. In fact, it seems to be getting more intense. So we are working on concurrent plans. We're going to have a lot of discussion this week and in the coming weeks about the RFP. I do also still believe that we will need as many placement resources as necessary for us to solve this problem. And I think having this space prepared, having it available for our immediate and long-term use will absolutely be a resource that will be a benefit to the county.
Through the chair,
Yes.
Mr. Merriman, would it be possible to request a walkthrough of the site?
Yes, absolutely.
Okay.
I do want to just say one thing. I think the times that I've gone over there recently to see it, it is sort of, it is like taped off, because I think they're doing some abatement. So I'd say, yes, you could do a walkthrough. I do want to make sure it's at a time that would be safe for you, as well as the other folks that are in the building.
Well, look forward to hearing from you.
Madam Chair,
Yes, Councilman.
do we have any estimate on the annual operating cost expected?
To the chair, no, I'm sorry, to the councilman, no. We, at this point, this was a part of our RFP process to get some counterfactuals, whether we were going to operate it within our own resource, or we were to engage with a partner to do that. So we're still modeling out those costs. We're directly working with Trumbull County, which is the county that has created on-site residential services that is our model. They have a different facility and a different structure, and we're working with them to finalize what we think would be sort of appropriate predictions of what the cost would be. Councilman, we're working on it, and as soon as we have it, we'll share it with you.
Okay, thank you.
All right, so we have another committee. I'm not going to belabor this, but I've been at Walk With You, David, and I've been pretty much abreast of most part of where we are and what this county needs to go in the direction of the children. But as I stated earlier, looking at this, there was specific requests for dollars does not really show a lot on the kid side. So, and going forward, before this is passed, we need to make sure that there's some money put. I've been on the outside of the campus, so it's not really welcoming to kids at the moment. Maybe that's in your plan. So I agree with Councilwoman Turner that we should set up a quick tour to go over there and look and see what these plans and what these dollars will exactly take care of, or if not, then we need more money. And because it all looks like HVAC and safety mechanisms. So without any further ado, this meeting is adjourned. And I want to apologize to